ENSPRYNG is a prescription medicine used to treat neuromyelitis optica spectrum disorder, NMOSD, in adults who are aquaporin 4, AQP4 antibody positive. It is not known if ENSPRYNG is safe and effective in children.
My name's Donna. My husband and I have been married over 40 years. We have 3 sons and 2 adorable grandchildren. I love my family a lot. They are my rock when I need them, and they are my joy all the time. It was Memorial Day weekend in 2013 when the lower half of my vision in my right eye resembled a snowy TV screen. I went immediately to an optometrist. He couldn't see a reason that I was losing my vision there, and said if it didn't get better, in 3 weeks to come back and see him. Well, 2 weeks later, I was just walking through the family room and all of a sudden my eye went black. It was very scary. I couldn't see anything. So the next day I was able to get into my ophthalmologist, and he did another exam, an MRI scan, which showed that there was a swelling in my optic nerve. My ophthalmologist thought maybe it was a stroke, so he referred me to a cardiologist, where I went through several different heart tests and everything came out normal. Eventually, I started working with a neurologist who put me through some more MRIs. He diagnosed me with NMO, or neuromyelitis optica. I had not heard of NMO before. I had no idea what it was. And I got on the internet to look up NMO, and what I found wasn't pretty. My neurologist told me that there was nothing as of yet on the market specifically for NMO, but he said that he was involved in a clinical trial for satralizumab that is specific for NMO, and he thought I would be a good candidate. Of course, satralizumab is now known as ENSPRYNG. I jumped into the idea of the clinical trial with both feet because not only did I want to help myself, but I wanted to help others. Before I started on the clinical trial, we discussed all the potential risks and benefits. My doctor explained to me that there were side effects with ENSPRYNG, some of which could be serious.
Who should not receive ENSPRYNG? Do not take ENSPRYNG if you are allergic to ENSPRYNG or any of the ingredients in ENSPRYNG, have an active hepatitis B infection, have active or untreated, inactive, latent tuberculosis. ENSPRYNG may cause serious side effects including infections, increased liver enzymes, low neutrophil count, serious allergic reactions. The most common side effects of ENSPRYNG include sore throat, runny nose, nasopharyngitis, rash, fatigue, extremity pain, headache, upper respiratory tract infection, nausea, inflammation of the stomach lining, gastritis, joint pain, arthralgia.
Today, ENSPRYNG is approved and has been shown to reduce the risk of possible relapse. My doctor and I are pleased with my results on ENSPRYNG. ENSPRYNG is a once-a-month injection. With training from my doctor, I now self-inject monthly from home. Since I've been doing the injections for a few months now, I've become very comfortable in doing it myself. My middle child has had type 1 diabetes since he's 11, so I was very comfortable with giving him an injection, and so I thought if he can do it every day, I can do it once a month. Yeah, he's my inspiration. I want to stay on treatment with ENSPRYNG because I feel that I want to reduce my risk of a relapse. A result of another relapse could affect my vision in my other eye, or it could affect my ability to walk or use my arms. I try to not let NMO stop me from doing things that make me happy. My husband and I enjoy a daily walk. We like to do Tai Chi. I like to stay active, but every once in a while my body tells me you're not going to do that today. And when that happens, I just stop, rest, and wait it out. My family really helps me with my positive attitude. If I have a down day, I just FaceTime my grandkids and they bring that smile right back to my face. My advice if you're living with NMO is to surround yourself with a good team, a good neurologist, and support people who will tell you what you need to hear, not what you think you want to hear. Make sure that they're upfront with you. The most important thing to me is to stay on treatment so I can reduce the risk of relapse. That's the most important thing.
Important safety information for NSPRYNG. What is NSPRYNG? NSPRYNG is a prescription medicine used to treat neuromyelitis optica spectrum disorder, NMOSD, in adults who are aquaporin 4, AQP4, antibody positive. It is not known if NSPRYNG is safe and effective in children. Who should not receive NSPRYNG? Do not take NSPRYNG if you are allergic to NSPRYNG or any of the ingredients in NSPRYNG, have an active hepatitis B infection, have active or untreated inactive, latent tuberculosis. What is the most important information I should know about NSPRYNG? NSPRYNG may cause serious side effects including infections. NSPRYNG can increase your risk of serious infections, some of which can be life-threatening. Talk to your healthcare provider if you are being treated for an infection, or call them right away if you think you have signs of an infection with or without a fever, such as chills, feeling tired, muscle aches, cough that will not go away or a sore throat, skin redness, swelling, tenderness, pain or sores on your body, diarrhea, belly pain or feeling sick, burning when you urinate or urinating more often than usual. Your healthcare provider will check if you have an infection and treat it if needed before you start or continue to take NSPRYNG. Your healthcare provider should test you for hepatitis and tuberculosis, TB, before you start taking NSPRYNG. All required vaccinations should be completed before starting NSPRYNG. People using NSPRYNG should not be given live or live attenuated vaccines. Live or live attenuated vaccines should be given at least 4 weeks before you start NSPRYNG. Your healthcare provider may recommend that you get a non-live, inactivated vaccine, such as some of the seasonal flu vaccines. If you plan to get a non-live, inactivated vaccine, it should be given, whenever possible, at least 2 weeks before you start NSPRYNG. Increased liver enzymes. Your healthcare provider should order blood tests to check your liver enzymes before and while you are taking NSPRYNG. Your healthcare provider will tell you how often you will need to have these blood tests. Make sure you get all of your follow-up blood tests as ordered by your healthcare provider. Your healthcare provider will tell you if you need to wait to start NSPRYNG if your liver enzymes are increased. Low neutrophil count. NSPRYNG can cause a decrease in your neutrophil counts in your blood. Neutrophils are white blood cells that help the body fight off bacterial infections. Your healthcare provider should order blood tests to check your neutrophil count while you are taking NSPRYNG. Serious allergic reactions. Serious allergic reactions that may be life-threatening have happened with other medicines like NSPRYNG. Tell your healthcare provider before taking your next dose if you had hives, rash, or flushing after your injection. Seek medical attention right away if you have any symptoms of a serious allergic reaction, such as shortness of breath or trouble breathing, dizziness or feeling faint, swelling of your lips, face, or tongue, moderate or severe stomach, abdominal, pain or vomiting, chest pain. Before you take NSPRYNG, tell your healthcare provider about all of your medical conditions, including if you have or think you have an infection. See, what is the most important information I should know about NSPRYNG? Have liver problems? Have ever had hepatitis B or are a carrier of the hepatitis B virus? Have had or have been in contact with someone with tuberculosis? Have had a recent vaccination or are scheduled to receive any vaccination? Are pregnant, think that you might be pregnant, or plan to become pregnant? It is not known if NSPRYNG will harm your unborn baby. Pregnancy registry. There is a registry for pregnant women who take NSPRYNG. The purpose of this registry is to check the health of the pregnant mother and her baby. If you are pregnant or become pregnant while taking NSPRYNG, talk to your healthcare provider about how you can join this pregnancy registry, or you may contact the registry at 1-833-277-9338 to enroll. are breastfeeding, or plan to breastfeed. It is not known if NSPRYNG passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take NSPRYNG. Tell your healthcare provider about all the medicines you are taking, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the most common side effects of NSPRYNG? The most common side effects of NSPRYNG include sore throat, runny nose, nasopharyngitis, rash, fatigue, extremity pain, headache, upper respiratory tract infection, nausea, inflammation of the stomach lining, gastritis, joint pain, arthralgia. These are not all the possible side effects of NSPRYNG. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Genentech at 1-888-835-2555. For more information, go to www.enspring.com or call 1-844-NSPRYNG. For additional safety information, please see the full prescribing information and medication guide.